Hi, my name is Jaden, and today I will be talking about metformin, which is also known as glucophage. Sorry, I'm horrible at pronouncing the drug names. So this medication classification is a biguanide, and exactly what it does in your body, or the mechanism of action, is it decreases your glucose production within your liver, which reduces the glucose absorption within your intestines, and then it improves your body's sensitivity to insulin, so your body's able to use more glucose more effectively. And this will easily lower your blood sugar, make it a whole lot easier to manage. This medication is an oral medication. There's different forms of it, so just depending on the different forms, you would want to educate your patient. Like if it's a tablet, just take it with some food to kind of minimize that GI upset that it can cause. And then you also want to let them know if they're taking the extended release form, do not crush it. It is supposed to be absorbed somewhere else within their body. So just let them know, do not crush it if necessary. This, like I said, it should be taken with meals to kind of help decrease that GI upset that it can cause. You want to take it at the same time every single day, just so your body gets used to that regular pattern of taking it. And then you want to start kind of with your low dose and then gradually increase to avoid any extreme side effects such as GI upset or whatnot. Metformin doesn't lower your blood sugar like that. It takes some time. It can take anywhere from several days to several weeks to start to see the effects. So you want to continue monitoring your blood glucose, monitoring those signs of hypo and hyperglycemia. Some common side effects of this medication consist of nausea, vomiting, diarrhea, those abdominal pains. Something unusual about this medication is it can cause a vitamin B12 deficiency, so you want to make sure that you are monitoring for that, and if needed, they may want to take a supplement if recommended by their provider. Another condition that can occur is lactic acidosis, which is pretty much just a buildup of the acid within your body. This can occur essentially, or for sure, especially in people with kidney problems or alcohol usage. So if the patients are experiencing any symptoms such as muscle pain, difficulty breathing, or tiredness, you want to tell them to discontinue the med right away and let their doctor know as soon as possible. Some safety considerations for metformin: this drug is processed throughout your kidneys, so you really want to make sure that you're monitoring that kidney function. And then monitoring that kidney function consists of creatinine, BUN, and creatinine clearance. So people with severe kidney issues should not be using metformin. Also, avoid alcohol, like I said, and then metformin can have several drug interactions. So just let your provider know of any other drugs that you may be taking. This med, I did not state this in the beginning and I should have, but it's pretty safe. It's recommended. People prefer, not in pregnancy. It's not really known in pregnancy yet, but this is a pretty safe drug and it doesn't cause those up and down extremes that insulin can. So that's why this drug is typically very well used. Something to know about this drug is it does not cause hypoglycemia unless it's used with other medications, but you want to let your patients know to just be aware of those hypoglycemia signs because it can occur, such as the dizziness, sweating, confusion, irritability, and let them know to take the 15 grams of that carbohydrate, such as juice, and then wait 5 minutes and then recheck their blood sugar. And if it's still low, eat something again if necessary, or repeat. You want to let your patient know that they should still be working out, following a daily regimen, 30 minutes a day for working out. And then they also want to be consistent with a healthy diet just to prevent any other complications. Excuse me. Metformin can also help with weight loss. So you kind of want to tell your patient just to watch out for that. Maybe lift some weights at the gym because they may be losing some of that, not just fat, but they can be losing muscle as well. So if they want to keep up with their strength, definitely go to the gym, work out. And then you want to let them know to continue checking their blood sugars regularly. Keep doing stuff to minimize their A1C every 3 months for their checkup. An important fact with this one is 48 hours before a procedure with contrast dye or contrast media, you want to tell the patient to not take metformin because that acts on the kidneys, and so does that, and it can cause acute kidney failure. So thank you for listening to me about metformin. I hope I provided some good stuff. Thank you.